You may see someone that advertises an all-on-4 for $17,000. And you can look at Bond Street Clinic, and Bond Street Clinic, we charge $27,000. So you think, oh boy, there's a big difference between the $17,000 and the $27,000. So on the surface, it looks like that. So what you've actually got to do is you compare apples with apples. And when you go into it and you look at it, remember I said the first thing we give you is we give you the 4 implants, which is the protocol that Professor Malo invented. And the first set of teeth is the trial teeth. I don't know if you can see them here. It's quite small here. I'm sharing it there. They're the plastic teeth. So some people charge you just for the plastic teeth and then don't charge you for the second set of teeth up front. So it's like you go in for the introductory offer, but when you look into it and you ask them and you say, okay, I know that the gold standard for all-on-4 is the Noble Biocare system that Professor Malo invented. And that incorporates 2 sets of teeth. And if I don't have the 2 sets of teeth, then you're not getting what was invented and you're not getting the research. So you need to ask the people, am I getting 2 sets of teeth? Is the second set of teeth, does it have a titanium bar inside? Because what happens, they might offer you $17,000 and then they say, oh, it's going to be another 8, 9, 10 to upgrade to the next one. And then some people will even try and say, well, the next set of teeth need to be porcelain. Well, I can tell you, Professor Malo says you should never put porcelain onto an all-on-4 in the first 12 months. And if you do, there's a risk you could damage the implants. But you'll see that people start advertising, well, we're different. We can do something different to the Malo protocol. We're a bit different. We can make you the final teeth with the titanium bar in 2 or 3 days. But what you want to ask them is, I don't want that, because what happens if my speech is wrong? What happens if my bite is wrong? What happens if I don't like the appearance? So it was designed to heal and to get all those things right. So what it actually is, it's just advertising. It's just being different. And it's being upfront and saying, well, we're different from Professor Malo because where else are we going to go? When you design something and you're the inventor and then you're the leader, everybody else is the follower. And it can be dentists are the follower trying to change the procedure. It's other implant companies that are trying to change the thing to do it and say, well, we've learned and we do it all better. But I can tell you something, ask them for the research, ask them for the papers to say that that's the right way of doing it. If you want research that's been here since 1995 so that what goes into you is not experimental, then that's what you need. It's what I want for you. So you need to decide that. So if you see somebody else and say, I'll give you the teeth in 3 days, ask, why should I have them in 3 days? Will they guarantee if I don't get the speech right, bite right, appearance right, I'm going to give you another set of teeth for nothing? And then you'll have the people who've been overseas. And, Malo Clinic around the world's been everywhere. And, I've been to Malo Clinic probably 30, 40 times. And I've been with Professor Malo operating at his chairside, me doing the operations more than anybody else in the world. So it's important to understand that people come and go to Thailand and have their treatment done. Then they come back to Australia and they don't realise that if you go overseas to have implants done, often it means 2 trips to have the implants done, not 1 trip because you need 2 sets of teeth. And if something goes wrong, are you going to get on a plane and go back to have it fixed? That's the really important decision you have to make. And I can tell you at the moment that I have got a glut of people who went overseas and now they can't go overseas if they've got a problem and they're in a dilemma and they turn up at my clinic and say, what can we do? So please, I can't stress enough, compare apples with apples, not apples with oranges. So what are the benefits of all-on-4? A great smile is certainly a benefit of All on 4. You'll get your new teeth in 24 hours. That's great. Gone are the days where we wait for implants to heal. As I said, the Speedy implant was designed for immediate loading. So ask them, everybody, am I getting no bone grafting? Am I getting immediate loading? Am I getting my teeth? And then you've got the gold standard of what you're going to achieve. And the teeth should look natural. They should feel natural. You might want Shane Warne white if you want. It's up to you. Often older people come in and say, I want really white teeth, and it can look a bit silly. That's the ability when we give you 2 sets of teeth, you can change your mind. So if you had the first set and you said, I think they're too white or they're not white enough, you can change your mind. So that's the beauty of it. Gold standard, don't forget it. No bone grafting. You wouldn't believe it, but some people, you might have seen people advertising a thing called All on 4 Plus. And you think, what the hell is plus? Because, you know, it's like buying the steak knives and they throw in the plates as well. And when you ask them what the plus is bone grafting. And hang on, but All on 4 was invented by Professor Malo not to have bone grafting. But these people are pushing All on 4 plus bone grafting. It makes no sense. So no, thank you. You don't want to pay for bone grafting. You don't need bone grafting. And the success rate of All on 4 is based on no bone grafting. So very, very important. You know, I don't expect you to read this x-ray and have a look, but you can see where the red arrow is, shows where the bone, when you take out teeth, and the bone that the teeth sat in, that's called alveolar bone. When that bone disappears, the teeth come out, the bone disappears. So the longer the teeth are out, generally, the more bone you lose. This is a case that I did many years ago, before All on 4 was invented, well before All on 4. And the only things we had at those stages is we had to do bone grafting. So this patient was a bone graft patient. He had bone taken from his hip, and you can see we put 1, 2, 3, 4, 5, 6, 7, 8 implants in the upper jaw. We put temporary implants in. We screwed his teeth in because in those days, you can't put implants in and load them. There was no immediate loading. And secondly, you wouldn't put them into grafted bone. So what we did is we did this so the patient went through an operation to have the bone grafting. Then he had an operation to put the implants in. We put the temporary implants, we made the teeth. And now you get a little bit surprised when you see this, it all dissolved and fell apart. The patient smoked. So if you smoke and you persist in smoking, this can happen. So this is exactly the reason that All on 4 was invented. We wanted to eliminate, if we could, big bone grafting cases. We wanted to eliminate 3 operations. We wanted 1 operation to make it simple for you. So we have laboratories that actually make the teeth. So they're there. They actually make the teeth themselves. So we design your new smile. Everything is in-house. It's a wonderful thing. So you don't need to be going from one place to another. I often say, people say to me, Larry, you know, I've been and I've had a consultation and somebody wants to do the implants, then they want to send me to somewhere else to do the teeth, and then I've got to go back and forward. And the problem then happens if 2 people do different jobs. What happens if the man who did the teeth, that implant fails? So the guy who did the teeth said, well, it's not my problem. And the guy who did the implant said, well, I'll put another one back, but then you need a new set of teeth. You see, you don't want to be in the middle. You want to be somewhere where you know you're going to spend a lot of money to have this done. You've got to get value for that money. You want to know that you're going to be looked after if I have a complication, because complications can happen between 3 and 5%. So you know that. So you need to be prepared that I may be in that, I may lose 1 implant and I may need it replaced. The beauty of All on 4 is that if you lose an implant, it's a simple procedure to replace the implant, and it's not a big procedure to actually change the teeth and fix it. It can be done in one day. So that's very, very important. So when you come to me, I'll explain exactly how that happens. I want you just to listen. This is one of our patients because I think it means a lot.
In the 4 weeks that I've had them, I've been able to eat so much better. Prior to that, I couldn't chew on meat. Bread is a no-no. So being able to eat nutritious food again has been a godsend. I've put on a little bit of weight because I had lost so much weight because my nutrition was so bad. I've regained my confidence that I had lost because whenever I spoke or laughed, I would do that so that people couldn't see that my dentures were moving about. It's a wonderful journey to be almost finished with, and I'm so looking forward to in half an hour having my brand new all on fours.
So I'm going to have a lot of questions that people ask along the journey. And will I feel any pain? Well, you can be asleep. This is Dr. Ray's on the left-hand side. He's a specialist anaesthetist, and Tim, he's specialist nurse. So we take no shortcuts. You've got an operating theatre to be for your safety. We make sure before the operation that you're actually fit and healthy. And what that means is we do an assessment for everybody before they have an operation. That means you have to have a blood test. That means you have to have an ECG to make sure you're fit and healthy. We will speak to your doctor. We may speak to your specialist. Some people are on blood thinners, and they're on blood thinners because they've had a heart attack previously. They've had DVTs. They might have had grafts to their coronary arteries. There's a whole range of things that people can be on. And if you're on blood thinners, that means that we have to speak to your doctors to see if we can back them off. So it's incredibly important that when you're making your decision where you get this done, that you're medically, someone looks at you in great deal, because it's not worth having troubles with your safety just for a set of teeth. And it's very important that whoever sees you goes very diligently into your medical background, because today I see patients that are on a lot of medications, a lot of different things, and it just happens just recently, Dr. Ray's very thorough. We did one of these blood tests for people, and we picked up a thing where a patient had an abnormality in their blood readings, and we sent them off to an endocrinologist, and he said, very, very lucky that they were diligent, because what could have been a problem if they'd proceeded. So just please, we do not compromise with your health. So look at this. What about recovery time? And you see this lovely lady here, and this was a journey. It looks like in the second photo that I've bashed the hell out of her, but she was on blood thinners. So remember I said that 100% of people will have swelling, and you can see she's got some swelling. 50% of people have got bruising, but if you're on blood thinners, you're more likely to bruise. But look, the good thing about bruising, it goes away. And look, 6 months later, it's completely gone, as you would expect. So, but it's important to understand the recovery time. And I say to people, it's about a week. It's about a week before you're ready to go back to work. I have some people have very little swelling, go back within a couple of days, but I generally say take a week to recover. That's what you actually need. So then what happens if you don't have enough bone in your upper jaw? And a lot of people come in and they have the 3D x-ray and they say, Larry, I've been wearing this denture for many years and I've got no bone. I've been told I don't have enough bone. Then what we're going to do is we're going to use these long implants called zygoma implants. They look a bit scary, but actually they only take another 5 minutes to put in. But please, please, write down, you only need to have these put in by an oral maxillofacial surgeon, and Mr. Kevin Spencer, that photo on the left, is probably the most experienced person in the country at doing these. He's certainly done the most. If you look where they go, they've got to be put in exactly the right position. I just warn you, because there's some general dentists who are doing them. And the general dentists are doing them where I think, in my opinion only, that it's an oral and maxillofacial surgeon's responsibility, and that's where I send all our patients, and Mr. Spencer looks after them for us in our same facility, so you still get your teeth within the same time frame, but he's able to do them, and if there's any problems, it's an area only